Bismillah ar-Rahman ar-Rahim. Our subject today is lymphoma. There are two common types of lymphoma. First, Hodgkin disease or Hodgkin lymphoma. Second, non-Hodgkin lymphoma. Lymphoma is the third most common neoplasm in children. Non-Hodgkin lymphoma is more common and more serious than Hodgkin disease. Hodgkin disease is almost always a nodal disease, arise from lymph nodes in 99% of cases. Non-Hodgkin lymphoma has three sites of origin which lead to a wide range of presentations. First, extranodal lymphatic tissue as lung and GIT, which is the most common. Second, nodal disease, which is the next common. And third is extralymphatic tissue, which is the least common. The peak incidence of Hodgkin disease, it is rare below 5 years of age. The peak age incidence is from 15 to 30 years of age and more than 50 years of age. Regarding non-Hodgkin lymphoma, it can occur at any age. Generally, most cases of lymphoma below 10 years of age are non-Hodgkin lymphoma. The clinical presentation. Lymphoma usually presents with one or more of the following presentations. Some presentations as abdominal mass and primary bone disease are peculiar to non-Hodgkin lymphoma. First, lymphadenopathy. It is the most common presentation. Cervical lymph nodes are the most common primary sites. Occasionally, supraclavicular, axillary, or inguinal nodes are the primary sites. The nodes are significantly or hugely enlarged. They are firm, discrete, non-tender, without regional inflammation. Single or multiple groups can be involved. The enlargement is usually discovered by the patient or his or her parents. Splenomegaly may be present. Second, mediastinal mass. Mediastinal lymph nodes enlargement can be the presentation of Hodgkin disease or non-Hodgkin lymphoma. It presents clinically with progressive dyspnea and feature of superior vena cava obstruction, like dilated veins over the upper part of the anterior chest wall with neck or facial edema. Chest X-ray clearly demonstrates the mediastinal widening. Third, malignant malaise. Prolonged fever, anorexia, malaise, night sweating, and weight loss can be the presentation of both Hodgkin disease and non-Hodgkin lymphoma. Fourth, abdominal mass, big intra-abdominal or retroperitoneal mass can be the main presentation of non-Hodgkin lymphoma. Ascites may be present. Fifth, primary bone disease. It can be the initial presentation of non-Hodgkin lymphoma. Progressive spinal cord compression, like paraplegia, should always arise suspicion. Sixth, pancytopenia. It is usually a manifestation of an advanced disease to occur due to either bone marrow infiltration or immunodestruction of the three blood elements, leading to anemia, purpura, and increased susceptibility to infection. The diagnosis of lymphoma by first nodal biopsy. It is the most reliable method for diagnosis and identification of the pathological type, especially in case presented with lymphadenopathy. Second, bone marrow biopsy. It may reveal the characteristic cells when the bone marrow is involved. Third, radiological studies like chest X-ray, skeletal survey, CT scan, and MRI. Types of lymphoma. In Hodgkin disease, the characteristic malignant cell is the Reed-Sternberg cell. Hodgkin disease is histologically divided into 4 subtypes with variable incidence and prognosis. 1. Nodular sclerosis, representing 50% of cases. 2. Mixed cellularity, 30%. 3. Lymphocyte predominance, 15%. 4. Lymphocyte depletion, 5%. In case of non-Hodgkin lymphoma, the malignant cells can be classified in different ways as follows. 1. According to the grade of malignancy, as low grade or high grade. Most childhood non-Hodgkin lymphoma are of the high grade type. 2. Histologically, as lymphocytic type, which is more common, or histiocytic type. 3. Immunologically, as T cell type, as in intestinal masses, or B cell type, as in abdominal masses. Treatment of lymphoma is usually by chemotherapy. And the last thing is prognosis of lymphoma. This depends on the following parameters. 1. Type. Hodgkin disease has much better prognosis than non-Hodgkin lymphoma. With Hodgkin disease, more than 90% of cases go into long remission with treatment, while with non-Hodgkin lymphoma, only 50% of cases can achieve such long remission. 2. Subtype. In Hodgkin disease, lymphocyte predominance has the best prognosis, followed by nodular sclerosis, mixed cellularity, and lymphocyte depletion, respectively. In non-Hodgkin lymphoma, T cell type has better prognosis than B cell type. And the last one is stage. Proper staging require careful clinical evaluation and laboratory investigations, and sometimes laparotomy. There are 4 stages according to the degree of spread of the disease. Stage 1 has the best prognosis, and stage 4 has the worst prognosis. شكرا جزيلا لحسن إصغائكم.